Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Gargi Rawat. Let's get you the data first. In India's COVID caseload has risen to over 3.09 crore with 38,792 new cases. That's 23% higher than yesterday. The deaths reported during that period are 624 and the total active cases currently are 4,29,946. Now, India has given 38.8 crore vaccine jabs so far, and yesterday India administered 37.14 lakh vaccines. But if we're to vaccinate at least 60% of our adult population by December, then our vaccine rate needs to be a lot higher. India must be vaccinating at least 89 lakh people every single day. There you can see the numbers. If we're to target 60% of the adult population, then 8.9 million or 89 lakh vaccines per day. Yesterday, we vaccinated just 37 lakh. That's 3.7 million a day, a shortfall of 5.2 million. And if we take a look at vaccine rates across the world and the proportion of population, well, the UK has vaccinated 51.4% of its population, the US 47.6%, and India, while it's vaccinated a huge number of people, it just amounts to 5.3% of our population. Now look at England that plans to drop most of its restrictions after the 19th, even though cases there are rising, but the vaccination rates are high. The Prime Minister has said it was vital to proceed with caution, warning that this pandemic is not over. In fact, UK reported 36,660 new COVID cases and 50 more COVID-related deaths in 24 hours. That's a big jump in the death numbers. Now, last week, over 100 scientists and medics, including Indian origin experts, issued a joint letter calling this a dangerous and unethical experiment of ending all legal lockdown restrictions. To talk more about this, we're joined by Professor Dr. Dipti Gurdasani, Senior Lecturer, Epidemiology, Queen Mary University of London, and someone who organized this letter. Thank you so much, Dr. Gurdasani, for joining us. And tell us more about this letter first.
So this letter raises serious concerns about the government's strategy to go ahead and lift almost all restrictions at a point in time where we are having a surging pandemic in the UK and only 52% of our population is fully vaccinated. We believe that this will lead to millions of young people and children being infected over the coming weeks. It's expected that 2 million or more young people will be infected, and we think that this will lead to our health services coming under significant pressure, but also leaving a generation of young people with the long-term impacts of a disease that we know is not acute. It can lead to chronic disability in many, and we think the impacts will be felt for many generations to come.
Right. So, because so far as children go, it's said that while they do get the infection, they don't get a very severe disease and they're not very affected by COVID. However, what you're saying is we still don't know. We don't know the long-term impacts.
Yes, we don't know the long-term impacts on children, and what we do know is very, very worrying. So we know that 7 to 8% of children go on to have symptoms for 3 months or more, and a significant number of those can have symptoms for a year or more. So for example, in the UK, we've had 9,000 children who've had symptoms for more than a year. That's not the flu, that's significant. And we know in adults that this is a virus that affects multiple parts of the body. It's not just a virus that affects the lung, it affects the heart, the kidneys, the brain. And we know that even in young people with mild infection, when you look at their brains, they have thinning of the brain at 6 months following infection. We haven't done the same studies in children, and we cannot possibly think it's okay to expose children to a virus when we don't understand its long-term impacts. And even children have long-term symptoms from this virus, suggesting that there might be something more sinister going on.
Right. If we take a look at, the cases and how many cases England has been reporting, and if we take a look at the deaths, we have those graphs on our screens, and it does seem that the deaths are very low, and while the cases are rising once again, that curve is rising, over 30,000 cases being reported over the last few days. However, the deaths have remained very, very low, and this is leading to authorities saying that, our vaccine wall is holding up well against the infections, and we're not seeing very severe disease.
Yes, I mean, it's very true that the vaccines have weakened the link between cases and deaths, but we are seeing rising hospitalizations. And even now, we have hospitals who are canceling routine operations when there are already millions of people waiting for their routine care. And cases do matter. Cases matter because they lead to long-term illnesses that we don't understand. And they also provide opportunities for this virus to evolve even more. Letting transmission continue in a partly vaccinated population, which is what we have in the UK now, is the ideal condition for this virus to move towards escape. And if we manage to evolve a new virus that escapes vaccines even more, that would not only take us months back in our response in the UK, but would affect response all over the world.
And we know that it's the Delta variant that's driving the infections in the UK, in fact, in England. And that's something that's been a bit of a setback because you've seen how the Delta variant has overtaken the Alpha variant. And now more and more cases are being reported of it. Do we know so far whether it causes more severe disease?
Yes, so we know from the UK data that it's about 1.5 to 2 times more likely to cause hospitalization. There's early data that's emerged from Canada and other countries that suggests that it's also more deadly. So we are dealing with a more transmissible variant, a more severe variant, and also a variant that is more likely to escape vaccines. 2 doses do provide very high levels of protection against severe disease, but we still have a level of escape against infection, which means people who are vaccinated can get infected and can transmit. Even though that possibility is reduced, it is still worse than, with the Alpha variant, which was the previous variant in the UK.
And it is argued that the vaccines are causing less severe disease, even with the Delta variant, even though the efficacy against the Delta variant goes down.
Yes, absolutely. So with 2 doses, the protection against severe disease is above 90%. So if you had 2 doses, it's individually highly protected. The protection against 1 dose is much lower. So it's very, very important that people get both of their doses to be protected against severe disease. But it doesn't necessarily have the same level of protection against getting it and transmitting it. So even people who are vaccinated need to take the precautions so that they don't get infected and transmit it to their loved ones.
And explain to us what will happen after the 19th when they say that all restrictions will be eased. There's also, we know nightclubs will open, big events will be allowed. There's also talk of something like a domestic vaccine passport. Just explain to us how it will be.
I mean, I'm very, very worried about this. So our modeling predicts that there will be millions of infections over the summer. So essentially the strategy appears to be that 51% of people have immunity through vaccination, and for the rest who are partially vaccinated or not vaccinated at all, it's going to be mass infection and possibly immunity through infection ahead of winter. And that's an extremely reckless strategy because, as I said earlier, it will leave many, many people with chronic illness and also possibly put unsustainable pressure on our health systems that are already struggling from 2 devastating waves of the pandemic, with about 13 million people expected to be waiting for routine care because of the disruption to our health services.
Of course, for the authorities, that the choice is between livelihoods and, well, not lives, but they hope that it's livelihoods that is also driving them to open up sooner and allow the economy to get back on its feet, as it were.
Yes, I mean, I feel this is a false dichotomy. We know that the countries that have done best in terms of economy are the ones that prioritize controlling the pandemic. It's unclear to me how people or the public are going to have the confidence to go out on transport, to go into shops when people aren't wearing masks. Our government has put down masks as a sort of symbol of restrictions, when actually masks help us be freer and interact in society and go out in society without the fear that we will get infected. So I think that this might actually badly backfire, and also we might end up in another lockdown if our hospital services start getting overwhelmed, which looks like it might be the case, which could actually devastate the economy even further. The government never seems to have understood that to protect the economy, you need to get on top of the pandemic. To provide routine care to patients, you need to get on top of the pandemic. As long as we look at these 2 things as different, we're never going to manage to protect both.
All right. Well, thank you so much, Dr. Gurudasani, for joining us. And it's a very fascinating. I mean, it's something that we're going to be watching very closely here in India as well. And many of you experts have said that this is an unethical experiment being carried out by authorities. Thanks so much for joining us. All right, with that, time for us to slip into a short break. We'll get you more COVID news on the other side. Stay with us. Welcome back. Now, with the coronavirus outbreak continuing to leave a trail of devastation across the world, vaccines is the only way we can stop this pandemic. And some pharma majors are also working on a cocktail of vaccines in order to increase the vaccine's potency and efficacy against the coronavirus infection. In fact, very famously, German Chancellor Angela Merkel has taken such a cocktail, a Merkel mix it's been called. But now the World Health Organization's chief scientist, Soumya Swaminathan, said that mixing and matching the COVID vaccines is a dangerous trend which could lead to a disaster, as there's very little data right now on its efficacy. Well, to talk more about this mix and matching of vaccines or vaccine cocktails, we're now joined by Dr. G.C. Khilnani, Chairman, PSRI, Institute of Pulmonary Critical Care and Sleep Medicine. Thank you so much, Doctor, for joining us. First and foremost, your view on this, because this is something we've been talking about for a few months. There was also that trial in Spain in which they looked at mixing and matching vaccines. We do know that other countries are also, conducting these experiments. So what is your view?
Gargi, my view is based on the data and the knowledge and the studies. The study that you are talking about was published in one of the most reputed journal in Lancet on 10th of July, where 420 people who received Covishield vaccine and were followed 8 to 12 weeks later by Pfizer vaccine. And what was found that their immunity was increased by 77-fold. And this was not only the antibody level, it was also associated with cell-mediated immunity. Another data came from Canada, where they tried Covishield after Covishield, Pfizer after Covishield, and Pfizer after Pfizer, and found that Pfizer after Covishield also gives a 50 to 100-fold enhanced immunity. So now the first trial that I was talking about is phase 2 trial though, and the control arm was a placebo arm, not another. But there is now, I think, sufficient data that it should not be called cocktail. It should be called serial vaccine with a different. All are aiming at spike protein. That is one thing. The platforms are different. Now it is important from the point of Indian perspective, when we are facing shortage of vaccines and we are expecting that soon the Pfizer vaccine and the Moderna vaccine, which are mRNA vaccine, will hit the Indian markets. It is important that now 90% of the Indians have received Covishield vaccine and we are struggling to get second dose. So this information should be utilized to the advantage of India, so that if we get other vaccine, we can give it as a second dose. And there is, I think, sufficient scientific basis and the data to show that immunity, if at all, it is more enhanced than giving 2 Covishield vaccine as compared to 1 Covishield and followed by 1 Pfizer or Moderna vaccine.
So what do we make of WHO's statement where they're saying that there's not enough data? So when will we know? When will the go-ahead come, or when will somebody decide that it's okay? WHO decide, or countries themselves decide that, all right, this is something we can go ahead with. We do know that Thailand is planning to do it with they had the Chinese vaccine, and now they're planning to mix it with the AstraZeneca vaccine.
So Gargi, if you go into the history of COVID, WHO never approved remdesivir. They took a lot of time in approving even corticosteroids. But you have to save the patient. So we started using remdesivir. So therefore, the approval will come. WHO has not yet approved even Covaxin, whereas the phase 3 trial have been published in the peer-reviewed journal. So over a period of time, I've got a conviction that WHO would also approve it after scrutinizing in their way that they have a system of doing it. I've been associated with them in some way. So they will approve it, but currently we have to preempt it in the sense that we have to get ready for getting other vaccines so that they can be utilized to our advantage in the form of mixing, or you want to call it cocktail or whatever. The bottom line is that whatever vaccines are available to us, we should utilize, and there is reasonable evidence that mixing Covishield, especially giving Covishield first and giving Pfizer afterwards, leads to enhanced immunity.
And how do we know which vaccines they'll have to be tested? Sputnik also is carrying out certain tests on mixing of vaccines.
So, currently the evidence, as I will repeat, Covishield after Covishield, number 1. Better is Pfizer after Covishield. Third is Pfizer after Pfizer, in that order. But the question is that we are not choosers at this moment.
That's true.
You don't have all these vaccines with us. My thinking as a physician, or whatever you may call it, is that numbers are important. We are, instead of 89 lakhs, we are only vaccinating 35, 40 at best, 45. To enhance it, if we can utilize Pfizer or Moderna vaccine for enhancing the numbers and ensuring that it gives a better immunity, why not? So that's my take on the subject.
All right, and in fact, in some countries they're talking about a third dose, a booster dose of the vaccine, and that's another debate also taking place at the same time when there's talk of mixing of vaccines to improve efficacy.
No, it's not a debate at all, Gargi. The third booster has to come. It comes in all diseases, and we know from the
so far in the US CDC and all have said it's not required, and actually, at a time you're saying when there's vaccine shortage, extra vaccines should go to countries that are facing a shortage currently.
No, let me clarify this. The countries who have got sufficient vaccine for their population, they must think of giving a third dose. Country like India, first complete the 2 dosages. Then think of the third dose, because third dose, so far we know that immunity lasts for 7 to 8 months, 210 days to be precise. Beyond that, no one knows how long that vaccine immunity would last. But going by the history of other vaccinations that we know, and India is a hub of vaccination, that all the majority of vaccinations, be it pneumonia vaccine, be it other vaccine, would require a booster. Now, when we know that the COVID immunity wanes off over a period of time, my scientific bent of mind thinks that there is no reason it will not require a third dose.
Right. In fact, Pfizer has said that they found the immunity does wane after a period. Thank you so much, Dr. Khilnani, for joining us.
Thank you very much.
Well, now for our campaign, Vaccinate India, in partnership with Google, and we take a look at some of the questions that all of you look up online, that you often Google about coronavirus and about the vaccines. And joining us to answer those questions is Dr. Abdul Ghaffur, Consultant Infectious Diseases, Apollo Hospital, Chennai. Thank you so much for joining us, Doctor. And some of the questions that people are looking up online is whether mothers who have COVID should breastfeed.
Those who are COVID positive must continue to breastfeed their baby. Why is that? Do you really think we should be worried about the baby getting COVID from the mother? Not really, because the chance of the baby getting COVID from the mother is very, very low. Why is that? Even if the baby is coming in close contact with the mother's skin, the chance of baby getting COVID is very low. And the chance of baby getting COVID from the breast milk is extremely rare. So overall, the chance of the infant or the baby getting COVID from the mother is low. Now, even if the baby gets COVID by any rare chance, usually we know that the COVID is usually very mild in skin. Even if there is a symptom, it's very mild symptom. So first of all, the chance of the baby getting COVID from the mother through breastfeeding is very rare, and even if symptoms at all. So what is the disadvantage of not breastfeeding? We all know that the breast milk is extremely important for the baby's immunity. The breast milk contains chemical substances that boost the baby's immunity. In fact, we are helping to build baby's immunity by breastfeeding. So, the advantage of the breastfeeding, even if the mom is COVID positive, is far outweighs the risk of baby getting COVID from the mother.
Right. But doctor, are there any precautions mothers should take when they're with their baby?
Of course, yes. Now, you hold the baby close only while breastfeeding. Otherwise, you keep the baby off, let somebody else look after the baby. Now just before breastfeeding, always wash your hands very well, wear a mask, if possible wear a shield. So clean your hands well, wear a mask, wear a face shield, and when breastfeeding is completed, let somebody else take care of the baby.
All right. Well, thank you so much, Dr. Kapoor, for joining us and answering those questions.